warning tonight from Central Indiana doctors. Respiratory virus season for kids is taking hold. WRTV's Nikki DeMentri has a warning from one mother who thought her daughter had a severe cold, but it turned out to be much worse.
I never thought that we would be dealing with RSV mid-September on an 80-degree day.
It started with what the Hahn family thought was a cold. 72 hours, a spiking fever, and a trip to urgent care later, doctors diagnosed 3-year-old Leilani with RSV and pneumonia.
Oh, yeah, it's been a ride, but I think we're past the scary part.
Hahn says her daughter is doing better following several rounds of steroids and antibiotics. But the Greenwood mom still took to Facebook to share her story as a warning to other parents. Respiratory season is here, and it's wreaking havoc.
I think that really is why we waited to take her, because it's not winter time. It's not your typical flu season.
From RSV to rhinovirus to enterovirus and everything in between, Riley Hospital for Children's Dr. John Christensen says current bed availability is tight.
There's a lot of resilient people, and they persevere and provide good care. But the reality is that, it definitely, there's a lot of stress on the system.
The infectious diseases doctor urges parents to ask these questions to determine if a child needs more medical attention. Is there breathing difficulty? Can a fever be controlled by medicine? And are they refusing to eat?
Right now, we're like double last week of our isolations of rhinovirus, enterovirus.
Dr. Christensen predicts RSV will peak in about a month, which is earlier than normal. As for influenza, he believes that'll take hold early in the new year. His best advice to parents, keep kids home if they're sick.
Imagine now COVID along with RSV, influenza, and all these other viruses circulating all at the same time. It's going to put quite a strain on healthcare systems.
Working for you, Nikki DeMentri, WRTV.
Well, the CDC issued a warning earlier this month about respiratory viruses impacting kids, especially because one variant is more common than in previous years. It's called enterovirus D68. The CDC says it's associated with a rare but serious neurologic complication that can cause limb weakness. Riley has not seen any D68 cases so far.
However, when we see a lot of enteroviruses in the community, we always have to be very attentive. So physicians are aware of it. Pediatricians in our system are aware of it. And if they see anybody with any kind of weakness of limbs and things like that, definitely there would be a workup that would be done.
There are no vaccines for rhino or enteroviruses, but flu shots and COVID shots for kids are available to cut back on the chance that your child will get a respiratory illness. The Children's Museum is partnering with Riley for a vaccine clinic this Sunday, the 25th. It's happening from 11 to 3. Flu and COVID-19 Pfizer vaccines will be available for anyone 6 months and up.